All right, so health officials say there has been a spike in COVID cases in New York City recently, and the rise comes amid the detection of a brand new coronavirus variant.
Meanwhile, tens of thousands of public school students start classes this week, including thousands of children of asylum seekers. Right now, there's growing concern about the vaccination requirements for the migrants. Joining us this morning, New York City Health Commissioner Dr. Ashwin Vasan. Nice to have you back on Good Day New York.
Thanks for having me.
Okay, school starts for New York City school kids Thursday. What are vaccination requirements?
Well, let me just say I can't wait. I have 3 kids ready to send them back to school. The requirements are the same. I want to be super clear. Requirements for all New York City public school students are exactly the same.
What are they?
They are things like your tetanus shots, your measles, mumps, rubella. There's a whole host of vaccines that kids need to be up. Polio, that kids need to be
What
up
about
to date
COVID?
on. COVID is not currently included in the required shots. That's a state Department of Education
And
decision.
how do you know with the migrants what they've had?
Well, this is the point of connecting them into care, connecting them into a pediatrician. As soon as they get to the navigation center at the Roosevelt Hotel, they get screened and then connected into care, and that's where a pediatrician can actually do those tests to see what a child is immune against.
So, so they're doing tests on the migrants so that they know what they have.
Well, I mean, vaccination documentation is hard, right?
Right, because how are you going to prove
hard.
it?
Some people are coming with fully filled out cards from the WHO, those yellow cards that sometimes we need for travel, but some don't, and that's where we can do blood tests and other things to see what are you actually immune against.
Yeah.
And we can also vaccinate even if there's a question mark, just to ensure that we have a new baseline.
And since we're talking about COVID, masks for children in schools. Do you foresee that ever happening this school year?
Look, I think we made tough choices during a tough time. We're in a different time now. If you're elderly, if you have an immune compromised condition, if you live with someone with those kinds of risks, those are the kinds of folks we're saying, make smart choices. You're going to spend a lot of time in the subway, in crowded settings, in crowded elevators, in public events. Wearing a mask prevents COVID spread. So take some smart decisions, but you know, we're not in the emergency time.
Good.
Let's talk about that new variant, because over the summer, and I think I heard this from a lot of people, there was, I experienced it as well, cold, flu-like, congestion, and I was like, I used a test. Everything came out negative. Are these tests not able to determine whether you have this new variant? No. We think the tests that we've been using are perfectly capable of capturing this new variant. I think you're speaking of 2.86, EA 2.86. The names are hard to keep straight.
Right, I was about to say.
But right now, you know, number one, we haven't seen a ton of 2.86 here in New York City. There's still kind of a variant soup rolling around. There is a new booster coming out in the next few weeks. By the end of September, we should have widespread access to a new booster. Everyone should go get boosted as a part of their routine re-up. You know, get your flu shot, get your COVID shot at the same time. I'm happy to come back and do yours like we did last year. But especially if you're a vulnerable person, 75 and older, 65 and older, if you've got an underlying chronic health condition, if your immune system is not healthy, those are the folks we're saying definitely go get boosted.
Let's talk about that spike, though, because you're saying that there's a, you know, we're talking about 20% increase. Is this mostly from people in hospitalizations? Is this mostly from people that have underlying immune disorders? Is this an older population? Like, what does that breakdown look like of the people we're talking about?
Well, a couple things to put it in context. This bump that we saw this summer, it is an observable long-term bump over many weeks, but it's nowhere near the bumps we've seen in other summers, the last 3 summers. So that's one. So while things are higher than before, not as high as previous years. So that's good news. Hospitalizations are objectively up. More than half of those are people who are hospitalized for something else than COVID. This has been a trend we've seen for more than a year now.
Okay, because they're not going in for COVID.
They're not going in for COVID.
They have something else and then they get COVID.
And then here's the kicker. Number one, the folks we're seeing who are getting severely ill, there's still a handful of folks getting severely ill, mostly unvaccinated, mostly above 75, or have some really significant underlying immune disorder or condition. And we're not seeing any change in the death rate. So even when people are getting severely ill, we know so much more. Our doctors and our hospitals know so much more about how to keep people alive and safe, even if they've got severe COVID. But it tells you something about vaccination. It prevents against severe illness and death, as it always has.
And what about if you had it and the immunity that, you know, you've had if you had COVID-19.
There's no doubt that prior infection offers some immunity. The question is really how long-term and how strong. And I think the jury's still out on that, which is why we're saying even if you've had it, go get boosted, get vaccinated,
So,
get yourself the highest level of protection
I know
possible.
you're busy this morning. There was rumor of a COVID-19 and a flu vaccine all in one. Is that available, and do you suggest it?
Not in the near term in terms of availability. I do suggest getting both of those vaccines at the same time. I did it last year with the Secretary of Health and Human Services. The side effects are minimal. Even if you've got a little bit of pain in your arm, you can get them together, but there's no interaction between the vaccines. Go get it as a part of your routine fall physical and get up to date as we enter into the winter.
Okay. All right. Some good advice there as we head into the school year and things start cooling down as well. Oh, here comes those fall colds.
All right. Thank you so much,
Thanks for
Dr.
having me.
Vasan. We appreciate you being here.